before I begin my assessment, I'll make sure that I've got my PPE on. Hi, I'm Gemma. I'm a second year paramedicine student. I've been asked to do a respiratory exam on you today. Can you please confirm your name and date of birth for me?
Daniel Short, 27th of November 1995.
Thank you. So what this respiratory exam will involve, it just starts from me doing some general observations of you from the end of the bed, and then moving up to examine, percuss, and also take your chest. Is that okay with you?
That's cool.
So we've got Dan seated at a 45-degree angle. What I'm going to get you to do is please take your shirt off to expose your chest so I can have a look. Is that okay? Thank you. Now Dan, before we start, do you have any pain at all anywhere?
No.
No? Fabulous. Cool. So from at the end of the bed, just general observations, I'd be looking to see whether Dan is short of breath at all, sort of his work of breathing, if he is able to speak in full sentences, which we've seen he is. I'd be looking for any bedside aids, treatments or adjuncts around him. I'd also be checking for any visible signs of scarring, looking at his chest wall symmetry, also looking for the presence of any cough, wheeze or PHCA, also any discoloration or cyanosis. Cool. So Dan, I'm going to start with an examination of your hands.
Yep.
Can I just get you to place your hands out like this? Also looking at his fingers, I'm looking for any signs of peripheral cyanosis. Can I get you to turn them over? Cool. So checking for any tar staining to indicate smoking. Also feeling temperature. So he's peripherally warm. Also going to feel your pulse. Also he's got a strong radial pulse. Dan, when I feel your pulse, can I get you to take a deep breath? Thank you. Oh, and I'm going to check for clubbing, so can I get you to put your fingernails together? Oh, so they sit flat. Can I now get you to place your hands out in front of you straight? Also looking for any signs of a fine tremor. And hands up. Also looking for any flapping tremors as well. Thank you. You can relax your arms. So I'm going to do an examination of your head and neck. Is that okay?
That's cool.
Yeah. So I'm just going to get you to pull down on your bottom eyelids. So checking for the colour, if there's any lesions or discolouring or anything like that. Can I please get you to open your mouth? Checking the colour in there as well. And place your tongue on the roof of your mouth. Checking for any signs of central cyanosis. It all seems clear. Cool. Now I'm just going to have a look at your neck.
Yep.
Can I please get you to turn your head away from me? So checking for the presence of the jugular vein, any jugular vein distension. Dan, do you have any pain in your stomach?
No.
No? Do you mind if I press?
Go for it.
No. So pressing on the liver, testing the hepatojugular reflex. Cool. So you can return your head to the normal position now, Dan.
Cool.
So I'm just going to have a look at your tracheal positioning. This can be a little bit uncomfortable though, is that okay?
Yeah, it's cool.
Yeah. So just keep your neck nice and relaxed. So I'm going to dip my index finger into the thorax beside the trachea, apply a little bit of pressure to locate it, and I'm going to compare on the same side. Check the location. Cool. So that's nice and straight. So if there was a difference on the sides, it would indicate that there's a slight deviation. I'm also going to measure the cricosternal distance. So I'm feeling from the suprasternal notch until the cricoid cartilage. 1, 2, and it's 3 fingers there. So 3 to 4 is normal. 1, 2, 3 fingers there. Great. So now Dan, I'm just going to have a quick closer inspection of your chest, if that's okay.
That's cool.
Yeah, so here I'm just looking at the general overview. I'm looking for any sign of scarring or anything like that. Any skin changes that could indicate things like radiotherapy or surgery. I'd also be looking for any asymmetry in his chest walls or anything, which could also indicate surgery. I'm also checking just for any general abnormalities or deformities. It all seems pretty normal. So I'm also just going to feel for an apex beat, which is 5th intercostal or mid-clavicular. I can feel a good apex beat, yeah. So now I'm just going to check your chest expansion. I'm just going to have to pop my hands over your chest. Is that okay?
Yeah, that's cool.
Yeah. Place my hand inferior to the knuckles. Cool. Now can I get you to please take a deep breath for me? Cool. Just checking symmetry. And another deep breath. Cool. So that looks nice and symmetrical. Both my thumbs are moving. Another one. Symmetrically. If there was a lack of movement on one side, it may suggest something such as a pneumothorax. Now Dan, I'm just going to percuss your chest. It may be a little bit uncomfortable as well, it's just a bit of tapping.
Okay.
Cool. So I'm going to place my non-dominant hand over the side I want to percuss. Cool. So I'll be listening for resonance, supraclavicular and infraclavicular. So if I was to hear dull sounds, could indicate an increase in tissue density. And if I was to hear hyperresonance, it's the opposite, and it could indicate a decrease in tissue density. So that sounds good. So that all sounds good. Now then I'm just going to oscillate your chest.
Yep.
So what I'll get you to do is take nice deep breaths in and out of your mouth.
Yes.
So I'm going to assess for quality rate and also volume. A decrease in volume will suggest that there's reduced air entry. So I'll just get you to take nice deep breaths. So it's got bilaterally clear chest sounds. There's no presence of any wheeze, any stridor, any crackles or anything like that, which is normal. Now then I'm going to perform a vocal resonance test. Yep. So what it means is just every time my stethoscope touches your chest, can I please get you to say the words 99?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Great, thank you, that sounds good. Now I'm just going to check your lymph nodes. So can I please get you to sit forward?
Yep.
Okay, so I'm just checking the lymph nodes. I'm starting anteriorly, posteriorly, just feeling for the lymph nodes and any abnormalities. So checking the supraclavicular and also the axillary nodes. So there's nothing abnormal there. So a lymphadenopathy may suggest that there's a malignant pathology or an infective pathology, but that all feels normal. Thanks, Dan. Now I'm just going to perform the same tests on your back, if that's okay?
Yep.
Yep. So I'm just going to check your chest expansion from here. Some nice deep breaths for me. Cool. And just making sure it's equal on this side as well. Great, thank you. I'm just going to percuss again. Cool, so that all sounds normal as well. So I'm just going to oscillate again. Got some nice deep breaths in and out of your mouth. Cool. So listening for nice clear bilateral ear entry again. Cool, so that's all nice and clear as well. Thanks, Dan. Now I'm just going to do the vocal resonance test again. So yeah, every time you can feel it touch your back, just say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99,
Cool, so that sounds good as well. You can sit back and relax now. So I'd just like to thank you for letting me do the respiratory assessment on you.
Cool.
You can pop your sheet back on now.
Sweet.
So to continue this assessment, I would do an SpO2 test to check his oxygen saturations. If this was low, I'd also give him supplementary oxygen. I would also perform a peak flow, use a peak flow meter to test that. And if it was indicated, I could do a full cardio assessment as well. In summary, I saw Dan, a 19-year-old young male, who from the end of the bed was comfortable with no shortness of breath. There was no signs of peripheral stigmata of respiratory disease. There was no presence of a tremor. Palpation revealed symmetrical chest expansion. Percussion was normal resonance. Auscultation revealed bilaterally clear air entry. And so this was a normal respiratory examination.